Hey everyone, welcome back to Graft Academy. Today we're answering a very common and important question. Is dental bone grafting covered by insurance? The answer is sometimes, but it depends on several factors. Dental insurance coverage for bone grafting can be confusing because different plans classify grafts in different ways. Let's break this down clearly so you know what to expect and what questions to ask before treatment. First, it's important to understand how insurance companies look at bone grafts. Most dental insurance plans separate procedures into two categories: medically necessary procedures and elective procedures. A bone graft is more likely to be covered when it's considered medically necessary. That usually means the graft is being done to treat disease, infection, or bone loss, not just to prepare for an implant. For example, if a bone graft is placed at the time of a tooth extraction due to infection, trauma, or periodontal disease, some insurance plans may offer partial coverage. This is often referred to as socket preservation. Because the graft helps prevent further bone loss and supports oral health, some plans classify it as a preventive or restorative procedure. On the other hand, if a bone graft is done specifically to prepare for a dental implant, many insurance companies consider it implant-related. Since most dental plans do not cover implants, they may also deny coverage for the graft that supports it. Even though the graft is medically important, the insurance company may label it as elective because of its connection to implant treatment. This is one of the most frustrating parts for patients. The graft may be necessary for long-term oral health, but the insurance company focuses on how the procedure is categorized, not always why it's needed. Another factor that affects coverage is timing. Bone grafts done at the same visit as an extraction are more likely to receive coverage than grafts done months or years later. Once bone loss has already occurred, insurance companies are more likely to classify grafting as reconstructive or implant-related, which reduces the chance of coverage. The type of insurance you have also matters. Traditional dental insurance plans tend to offer limited coverage for bone grafting, if any. Medical insurance may cover grafting in rare cases, such as trauma, tumors, or severe pathology, but routine dental grafts are usually excluded. Some patients have both dental and medical insurance, and in certain situations, the dental office may submit claims to both. This doesn't guarantee coverage, but it can sometimes improve reimbursement when the graft is related to a medical diagnosis. Coverage levels, when approved, are usually partial. Most plans that cover bone grafting pay anywhere from 25 to 50% of the cost, up to an annual maximum. That means even when coverage applies, patients often still have an out-of-pocket portion. It's also important to understand that insurance approval does not reflect the quality or necessity of the treatment. A denial doesn't mean the graft isn't needed. It simply means the plan doesn't include that procedure under its benefits. So what should you do if you're planning a bone graft? First, ask your dental office to perform a benefits check before treatment. They can submit a pre-authorization to your insurance company and give you an estimate of coverage, if any. This helps avoid surprises later. Second, ask how the procedure will be coded. Different codes may apply depending on whether the graft is done with an extraction for periodontal reasons or as part of implant planning. Coding can affect how the insurance company reviews the claim. Third, ask about alternatives or timing options. In some cases, placing the graft at the time of extraction can be more cost-effective than waiting. Your dentist can explain the best clinical option and how it may impact insurance coverage. It's also worth asking about payment options. Many dental offices offer payment plans or financing to help manage costs when insurance coverage is limited. Bone grafting is often an investment that prevents more expensive procedures later. To summarize, dental insurance may cover bone grafting in certain situations, especially when it's medically necessary or done at the time of extraction. Grafts related to implants are less likely to be covered. Coverage varies widely by plan, and when approved, it's usually partial. The best way to know what your plan will cover is to check in advance and ask the right questions. That way, you can make informed decisions about your care without unnecessary stress. If you found this video helpful, make sure to like, subscribe, and share it with someone planning dental treatment or implants. Graft Academy publishes educational videos to help you understand dental bone grafting, implant dentistry, and modern oral surgery in clear, simple language. Thanks for watching, and we'll see you in the next episode.